Hi, I'm Dr. Marty Gallagher, and I'm a medical doctor, a chiropractor, and a medical acupuncturist. I teach at the Hackett-Himmel-Patterson Foundation, teach prolotherapy, regenerative medicine, and also teach at West Virginia University, Department of Family Medicine, where I teach regenerative medicine, medical acupuncture, and prolotherapy. I started with the Hackett-Himmel-Patterson Foundation in 2008 when I went to Honduras, and a couple interesting things happened. Number one, I had chronic low back pain and neck pain. Some of the back pain began at age 14. I had multiple injuries in basketball, baseball, and rugby, several car accidents and falls, and everything would get temporarily better. Thank God for chiropractic. It kept me functioning in the right direction. But I got to the stage where things were just chronic with back pain, leg pain, numb arm and hands. Could never really have comfort of any type. So I had heard about prolotherapy and read about it a little bit in the Townsend newsletter and talked to a few people and went to Honduras. Several things happened. One is I found a great method of healing that I saw patients respond to back pain, neck pain, shoulder pain from the treatment that we were doing. And number two, I was personally treated for these problems. And my chronic neck and back pain and leg pain started to resolve actually after one treatment. So as a result of that treatment, within a matter of 8 months, I could pick my wife up, who weighs 95 pounds. I couldn't pick up 5 pounds prior to that. I could never be comfortable in a chair. If I drove, I'd have to get out of the car every half hour. And it was something I just lived with chronically, but never took pain meds or anything like that. So I consider that to be a major blessing. And I thought, well, gee, I mean, this is wonderful for me. I went back to Pittsburgh in my practice, which is a large practice of integrative medicine. We do chiropractic, and then began prolotherapy and acupuncture and oral and IV vitamin therapy, what is now considered to be integrative medicine. And I started seeing magic. I started treating people's knees, and they got to the stage they could walk up and down stairs. They get in and out of cars. All these functions were returning. People with chronic neck instability leading to numbness and tingling in the arms and hands, migraine headaches. I started injecting the cervical spine, the low back for the very kind of problems I had. And it was mind-altering, career-altering as a result of that. So I was always extremely appreciative of the help that I received from the mentors at Hackett-Himmel-Patterson Foundation, because there are people who teach things and then people who are invested in your outcomes and your personal well-being. And that's what this organization is all about, which is how can I not only instruct you, but how can I help you grow as a person, a better doctor? There's a community, a family. And what I love about it too is the egos go away when you come here. Most of the medical conferences, it's all about, I'm the doctor, I'm in control, I do these wonderful things. Here it's like, I'm treating this patient, how do you do it? What are some of the techniques you can use? So it's a constant learning experience. So as an outgrowth of that, I decided to work with David Rabigo, who did the original study on prolotherapy with Jeff Patterson for knee, which is a major published study on knee osteoarthritis. And I engaged David to be involved with the Gallagher Foundation. The Gallagher Foundation is a prolotherapy foundation. We started at the University of Wisconsin Department of Family Medicine, and we take 1 or 2 residents every year and provide them an award to come to the foundation meeting, as well as travel to Honduras and have direct training. And so that's a foundation that we started years ago, and we're continuing that foundation. So why do that? I do that because I've been helped. I have literally, I'm not exaggerating, thousands of patients that have been helped by this treatment. And as a family doctor, I also want to see family medicine. Prolotherapy started in family medicine. It should be brought back to family medicine. So we're training the residents at West Virginia University, where I'm on the faculty there. We're training them in medical acupuncture, as well as we're starting prolotherapy with them as well. And as I say, instead of using steroids, use a better solution to get a better solution. So we can use prolotherapy solution instead of steroids to get better outcomes. The other interesting thing that occurs is for doctors that aren't familiar with helping patients, in other words, are used to referring them or giving them medication, and they see pain patients as more of a headache, all of a sudden the inner healer that exists comes out because, wow, I helped that patient's chronic ankle problem. They can play tennis again. They haven't been able to play for 10 years, right? They can sit in a car. They can travel. They can do the things they want to do. They're functioning well again. So why give? Well, for that very reason. Now, is there additional benefits beyond that? Well, obviously, to the practitioner, there's also not only emotional, spiritual benefits, there's also economic benefits. So it doesn't make sense to give that back. So in whatever way you can, I'd recommend it.